Bringing a baby into the world for some persons is a total joy, while for others it is just unspeakable fear. When I gave birth in 2012, I thought it was going to be laced with drama and I was going to scream out my lungs because of the intense pain that I had anticipated I would have felt. This was based on some of the experiences that I heard about from other persons and from what I saw on TV. I knew that every birth delivery is different. However, the one constant thing that always comes up is the intensity of the pain. So some persons describe labor pains as the top most intense pain that can be felt by humans. I was, however, pleasantly surprised that my experience turned out to be quite the opposite. It was wonderful, I must admit, totally pain-free and drama-free, as I did not go into active labor, but my baby was safely delivered. The other mom next door my hospital room screamed in agony for more than an hour and ate a whole dish of ice. The matron had to stop her at one point and I queried the reason for chewing the ice, and the nurse informed me that it helps some women to cope a little better with the pain. Now, this is a concise version of my experience leading up to the delivery. It was a cold October morning and I was 38 weeks along. I woke around 4:30 a.m. to empty my bladder and my water conveniently decided to break at that very same time. I count my lucky stars to this day, as honestly it could not have happened at a better place. For some strange reason, I had walked with my phone. It was the very first time that I was taking my phone to the bathroom with me at that hour of the morning. I honestly do not know what propelled me to walk with the phone at that hour, because it is not the norm. It is something I just never ever thought of doing. It was just get to the bathroom quickly, in and out. So because of that, I was able to sit and allow the water to flow freely while I called the doctor and all the relevant persons that I needed to call at that time. The day before, I remember standing up for longer than normal to assist a client at work. I was slightly bent over a computer keyboard for more than 20 minutes, so I am not sure if having my stomach in that position, slightly bent for that long, is what actually contributed to the baby tilting further down than normal and the reason my water broke when it did. My husband was on the night shift at work, which was approximately an hour's drive away, so he was not able to make it home in time to transport me to the hospital. So what I did, I called my OBGYN and informed him of the situation, and he told me that I should check myself into the hospital. I got dressed, called my sister who was nearby and asked her to carry the small suitcase that I had packed weeks before. I spread a very thick towel and plastic on my car seat in the event the delivery had to take place in the car. And then I drove myself to the Nuttall Memorial Hospital, which was only a 15 minutes drive away. Now, all the traffic lights were on green at that hour of the morning, so I did not have to stop any at all. I just drove straight to the hospital. I checked in a little after 5 a.m. and got prepped for the delivery. I opted for the C-section as my OBGYN had a 12 o'clock flight out of the country that day, and I was not too keen on having the assistant do the delivery. And you had to make it to the airport like 2 hours before the flight. He was not the assistant surgeon, was not someone I was familiar with. So, and I also chose that option as I wanted to avoid any possible complications that might be associated with natural birth, since it was my first delivery and I was really anxious to see what the baby looked like. By 11:07 a.m., Rav was out screaming at the top of his lungs. I quickly checked the fingers and toes and saw that everything seemed to be where they were supposed to be at that time. The nurses who attended to me at Nuttall and also to the baby were quite amazing. They were very professional, very respectful, and they treated me like how a new mom ought to be treated. They made me feel like I was the only new mother at the hospital, when in fact it was 4 of us there. I always got my meals on time, I got my medication on time, and they were patient enough to show me how to care for myself and the baby. And they were willing to answer the many questions that I had. As a first-time mom, we usually have quite a number of questions that we want to ask these nurses, and they were very patient, very understanding, and they spoke to in such calmness. They were very professional, I must say. So the experience there with the nurses was really good. Now, the entire cost to deliver at Nuttall then was $420,000. So it was $170,000 for the hospital charges and $250,000 for the surgeon's fee. What I will do is make a comparison of the approximate 2021 cost of giving birth in 4 maternity hospitals in Kingston and St. These are the Victoria Jubilee Hospital, the University of the West Indies Hospital, Andrews Memorial, and Nuttall Memorial. At the Nuttall Memorial, which is a private hospital, the current cost for natural delivery is approximately $600,000, and for a C-section it is almost $1 million in total. The Victoria Jubilee now is a public hospital, and it is considered the best maternity hospital as it is fully equipped with the necessary resources to ensure safe delivery. It is also the largest in the English-speaking Caribbean. The cost is totally free. So if you have to do a natural delivery, it is free. If you have to do a C-section, it is also free. The only drawback using this facility is the overwhelming number of patients, the overworked nurses, the not too ideal location, and the lack of beds. Beds are shared at the facility, and persons have shared numerous harrowing stories of their experiences giving birth in that public hospital. There are, however, others who have shared that their birth or delivery experience at the facility was quite good. And less than 3 years ago, the hospital was renovated with state-of-the-art equipment, and from pictures shown, the environment seems quite conducive for labor and delivery. The University Hospital of the West Indies offers both a private and a semi-private maternity services. The overall fees for semi-private is approximately $90,000 for natural birth, and for a C-section it is $210,000. So for persons who wish to go the semi-private route at the University Hospital of the West Indies, if you're doing a natural delivery, it is around $90,000, and a C-section is $210,000. Now, the fee for private patients who deliver naturally is $200,000. So that is like $110,000 more if you choose to book as a private patient. Now, if you have to do a C-section as a private patient, then the cost is around $352,000. No, it can be a little more or a little less depending on the specific needs of the individual. So some persons may require more disposables and medication than others. Hence the reason an exact cost can never be given, and the cost for me might be different from the cost for another expectant mother based on the needs, based on how much medication is required, based on how many disposables are actually used. At the Andrews Memorial Hospital, which is a private facility, the overall fee is approximately $480,000 for natural delivery, and for the C-section, it is around $750,000. Now, as you see from these 4 options, there is one to suit every pocket and every expectant mother. The choice of facility is solely dependent on the individual. An expectant mother will choose based on location, her financial situation, and the level of comfort that she requires. Booking a facility is crucial, especially at the private hospitals where you cannot just turn up when you are in labor and demand that your baby be delivered at that particular facility if you had not booked before, as they will turn you away without even batting an eyelash. Advance booking is required at all the hospitals, even at the public hospitals. Expectant mothers are required to register by 12 weeks at the Victoria Jubilee, between 8 to 16 weeks at the University Hospital of the West Indies, by 20 weeks at Andrews Memorial, and by 24 weeks at Nuttall Memorial. Now, for those who are nervous about delivering, try to remain calm and relaxed. Worrying never helps a situation. Just allow your body to do what it was designed to do. Allow things to happen as natural as they can. Also, if you have not done so yet, please click the subscribe button and share the video. Help even one expectant mother and father who I am sure will be grateful to weigh their options from early without enduring all the hassle of visiting the various hospitals before making a choice. Expectant mothers, I wish you all a safe delivery and enjoy your blessings.